And we know that strengthening healthcare is probably one of the hardest things to do when there's resource challenges, and yet it has to remain a priority.
Rotavirus. Many countries don't have rotavirus vaccines. They're called new vaccines. They're not new vaccines. They're old vaccines. And so why aren't countries introducing these? It's not through lack of interest or lack of, knowledge, by and large. It's because they can't afford it.
Welcome back to the WSPID podcast series brought to you by the World Society for Pediatric Infectious Diseases. I'm Alicia Chan, a pediatric infectious diseases specialist working in Guatemala City, and I'm your host for this episode. Today, we are discussing the strategies to promote child health equity by building trust in vaccines and public health initiatives within communities. To discuss this topic, we are joined by the wonderful Professor Fiona Russell and Professor Asha Bowen. Professor Fiona Russell is the director of the Child and Adolescent Health PhD program at the Department of Pediatrics, University of Melbourne. She holds various WHO advisory roles, including membership of WHO Strategic Advisory Group of Experts on Immunization from 2026 and the WHO TAC member for strengthening clinical trials. She is group leader for the Asia Pacific Health Research at Murdoch Children's Research Institute and co-chairs the WSPID International Scientific Committee. Professor Asha Bowen, OAM, is a clinician scientist working across the Perth Children's Hospital as a pediatric infectious diseases specialist. She also works across the Kids Research Institute in Australia as head of the Healthy Skin and ARF prevention team. Asha is currently the president of the WSPID Society, the first ever female president in the 30 years of the society's history. So we are very proud to have you both here with us, and I thank you very much for taking the time to join me today. Today we are talking about a very important topic, the role of the pediatrician in public health advocacy. And we're going to start by talking a little bit about what are the current challenges in this area. So if we may start with Asha, what are the common barriers to trust in vaccines and public health? And can you share real world examples of vaccine hesitancy and mistrust in different communities, Asha?
Thanks, Alicia. It is, I think, a core role for pediatricians to have a perspective on advocacy, to consider what our voice can be, and always be thinking about how do we promote the best possible outcomes for children and to continuously improve outcomes for children and young people. So vaccines, I think, are a key tool to that for pediatric infectious diseases because there are so many diseases that we don't see anymore because of the efficacy of vaccines. But I think since they've been developed, and probably from the very earliest days, people have had a sense of uncertainty, unclear understanding of what's going on in the immune system when a vaccine gets delivered. And there has always been, I think, even from the very early days when Jenner invented, first demonstrated the efficacy of a vaccine to prevent smallpox, uncertainty. And if you allow science to be communicated very well, then I think that dispels that level of uncertainty. When science gets muddied, confused, or potentially used and abused by scientists, you end up in some really difficult territories. And I think a great example about that in vaccines has been the story of the MMR vaccine and how autism has been introduced into that perspective. And I think that's a travesty of publication bias and potentially of poor practices that have enabled people to get into really divided perspectives. So what I think the role of the pediatrician is to develop both a story around the benefit of vaccines, the ability to communicate that really clearly, and to communicate it clearly from anything from the individual and their family all the way through to being able to speak to the media and having a large sort of millions of people platform to listen to what the benefits of vaccines are. I think storytelling is really helpful. And you asked us about stories that we have on vaccine hesitancy. And I can think of my most recent week on call where I've just had a couple of families that had uncertainties about vaccines. And it came down to things that they believed that had been sort of built into their family perspectives from when they were children. And so these parents trying to make decisions about their newborn and understanding what was best for that particular child really was influenced by what they'd heard from their parents and their communities, from social media, from the media. And so it reminds us, I think, as pediatricians, how important it is to challenge those perspectives, to be confident in communicating clearly about the benefits of vaccines, to be making sure those messages are available to people in the languages and the cultures that they understand. And so making sure that we don't only always speak that message in scientific language or in my first language is English. I have to make sure that other languages are used in communicating that message, but was able to sit with these families and create the space where we could equally discuss what the pros and cons of the vaccines were for them and their child, and then move forward and come up with a plan that worked for that particular family. So that was just my most recent week on call as a pediatric infectious diseases specialist. Had a couple of times where those skills were called on for the individual. But then I think we also always have to remember that when we're taking care of the one child, we're actually advancing healthcare for all children. And so our voice has to be multi-layered and accessible to lots and lots of different people so that the vaccine message can continuously move forward. I think that idea of building trust is harder than ever. And I think that there are many, many, many ways that trust has been eroded particularly over the COVID pandemic, but probably for many years before that. And we have to keep on being, I guess, creative and courageous in moving forward and trying to communicate what we think is the best for health outcomes for children and the future. Fiona, did you have anything else that you wanted to add to that?
Oh, fantastic, Asha. I think you've covered everything really comprehensively. Just a couple of things. I mean, I'd fully really emphasize what you said there about, opportunistically, as you say, the role of the pediatrician in terms of having those conversations with individuals at every point of contact, really. And our job is really to ensure children's needs are being addressed and when they're not, to be able to take action. But some of the examples, I think we're in a very precarious state globally at the moment. And I think it's out of the back of COVID. And as Asha said, the mistrust in science and mistrust in public health were some of the decisions which were made, which is now spilling over, unfortunately, into the infant vaccine programs, which have been so successful, as Asha has said, over decades that, thankfully, a lot of these diseases we don't actually see anymore because they have been so successful. But now, measles, as Asha said, is really is sort of like the canary in the coal mine, really. And that's incredibly disturbing to see what's happening with the undermining of that vaccine. There's deaths from measles all the time globally. They're all preventable. There's a safe and effective vaccine that's available, and the grief and the long-term guilt, I would imagine, for parents, not being able to or not having their children vaccinated it's unimaginable to me, how something like that, how families actually cope with that. So in terms of a real-world example, just close to home, before COVID as well, I think it was 2018, in the small Pacific Island country of Samoa, there was a measles outbreak. And at that time, measles vaccine coverage was quite low. And there was an error made by a nurse in administering the vaccine to a couple of the children, and 2 children died because of an error of administration. It wasn't the vaccine itself, but it was mixing it with a muscle relaxant. And so it was a muscle relaxant, so it was a nursing error. And so there was a huge amount, as you can imagine, community hesitation with getting that vaccine. But then because of that, then measles was introduced. The population was very vulnerable. And then there was a whole lot of misinformation at a very high level too, and that come into the community and being circulated on social media as well. And more than 80 children died in a very tiny country in Samoa. I mean, again, that's completely preventable and incredibly sad and should never, ever happen again. And so we're at risk of that. We're at the risk of that in even a larger scale with what's going on in terms of undermining the value of benefits. As Asha said, there's always, there's risks and benefits. All vaccines, all medicines, everything has side effects. But those side effects and the benefits are carefully weighed by scientists who spend their whole life looking at data, monitoring, and there's systems in place and very good systems in place to do safety monitoring. And as Asha has sort of mentioned, that link on social media regarding autism and measles vaccine is wrong. It has been proven to be wrong. It does not exist. But people, of course, start to feel concerned about this because it's all out there and it floods the media. So just to be very clear that the measles vaccine is safe and there is no link with autism, and it's a completely preventable disease. But I think we have to stay on the front foot of this. We have to all be active. We all have to be doing more. And particularly as paediatricians, and this undermining of infant programs is really extremely concerning. So I think we have to do more than ever. And so it's wonderful that WSPID is doing this podcast and doing what can to sort of also dispel this misinformation as well.
Thank you both. Really very, very relevant information and comments. Yes, Asha?
Well, I was just going to jump in with a story of pediatricians at work in responding to vaccine safety concerns and then building networks and platforms to be able to really reassure the public. And I think this was quite an important thing during COVID. But in my state, in Western Australia, we had some of the first H1N1 vaccines administered to children. And we were the first state in Australia to recognise that the vaccine was causing febrile seizures. And so we were able to, without actually having a safety platform in place, through the conversations of paediatricians, through people going astutely, there's something not quite right here, really recognise very quickly what was going on. And from that, stopped a vaccine that was unsafe in children. So it's an example where I think it's an important story to be able to tell, because when a vaccine is having a bad side effect, it has to be able to be recognized very, very early. And so this was where pediatricians were talking with one another and saying, I feel like there's more febrile seizures than I think we should be seeing. What's going on here? And within 6 weeks of the program starting, it was stopped. That is not without some children suffering significant harm, for which I think there has been a really good program implemented to prevent that from ever happening again. And so pediatricians now have a role in that vaccine safety space to really be creatively coming up with tools to monitor what's going on. And in Australia, we have a program where a text message is sent to families who've received a vaccine within sort of a day of receiving the vaccine, so that they can then respond over the next 7 days with any side effects that have occurred, from a fever through to anything that concerns them and needed to be hospitalised or a medical visit. And so then we can really use all of that data to be able to reassure the public about the safety of vaccines. So it's been a program that's come from a vaccine challenge, and I think is a really important way that paediatricians have worked together to ensure that can be resolved.
I think that is a wonderful idea. I mean, we're going to talk a little bit about the strategies for building trust in public health. So again, Asha, how can pediatricians serve as trusted messengers within their communities? How can they really be, beacons of truth in terms of what vaccines are and why are the vaccines important in a community?
Great question, Alicia. I think as paediatricians, we have a role to work first and foremost with the children and their families who are presenting to us for care. And so being really clearly able to be trusted in that communication setting. So as a junior paediatrician or as a trainee, really focusing on communication skills, thinking about and watching those who are around you and learning from all of them and trying to take the best of what you're seeing from all of the different role models that you have. So a tip for trainees is really be observant about communication skills, both what is said, how it's said, but also, I guess, the body language, the settings, and the different aspects that people might set up to be able to deliver a message effectively, compassionately, and to be able to be heard by the family that you're serving, who may be afraid, who may have mistrust, who may have many, many different perspectives coming into a healthcare encounter. So I think that's the very, very first thing, is get good at what we do and how we do it. And so it's all about that communication at the bedside, in the clinic, and learning from those more senior than you. But it's then elevating those skills, I think, realizing that you have got an opportunity, a platform, and the voice to really make a difference, to reassure, to help families, and to I guess, elevate that from the individual that you're caring for to the millions of children and billions of children are in the globe. And so I think Fiona and I both had a lot of opportunities to do this during COVID, particularly because there were so many things that were being done at a public health level that were disadvantaging children whilst continuing to promote keeping the community safe. And so the specific example is around, I guess, the issue of school closures. And we, as a group in Australia, every time a decision was made, we came together, we had a discussion about what are the key messages, who can communicate those key messages, and then thinking about how we might be able to advocate. And it might have been at a public health level, speaking behind closed doors, being in the rooms to meet with officials who are making decisions, but also making sure that a safety message was being really well and thoroughly communicated to the community through media, through social media, and through different platforms. So really thinking about your opportunities. And I guess what my message is for trainees is that you're refining those skills on a daily basis as you're caring for patients. So keep on refining your communication skills, thinking about how you communicate with clarity, with compassion, and with courage, because sometimes you do have to say things that are difficult. Sometimes you do have to say things that people don't want to hear, but they need to have that perspective to be able to make their best possible decision. So I think thinking about our role as pediatricians from the bedside all the way through to what I call beyond, which is, all of the different elements. It might be your writing skills, it might be your spoken voice, it might be presentation skills, but really making sure that you're presenting with a united voice, but also with a clear voice, something that can reassure and continuously build trust so that you're seen as a trusted voice in the community. I think Fiona has even better examples of this, and really love to hear her perspective as well.
Yes, no worries, Asha. No, that was great. I do most work on, rather than at an individual level, but more at a policy and sort of program level. So I can talk to that some more. So I guess COVID was a particular good example, as Asha's already mentioned. We're coming together, but I think courage is certainly one of those things, particularly in that context. But the other thing also is, one of the really critical things is having quality evidence as well. And not everyone has a background in that, which is fair enough. Some people are clinicians, others are clinician scientists, others are more the science side, which is, everyone's got a different skill set, and some people are better communicators than others as well. So, but if, depending on where your area of expertise is, always make sure that the evidence behind what you're saying is strong, because that is really critical, and that is the most fundamental thing for trust, and to maintain trust and integrity, and to maintain that into the future. And that's what some of the problem was with the pandemic, was not using quality evidence or saying there was when there wasn't. And the other way, and so if you don't have those skills, then work with people who do. And the way that you can do that is by joining professional societies. So as Asha sort of mentioned, through ANSPID, for example, or SLEEP-A or ESPID, or whoever it is, or your own college of pediatricians within your country. Really important to work as a team. rather than an individual as well on that level. And one of the things, again, during COVID that we did, we realised that a lot of the people in the media really had no idea about vaccines. And what they were saying about vaccines was really wrong, technically wrong. And so what we did, again, through our professional society, through ACID, we organised a whole lot of webinars to educate our adult physicians in particular who have got less experience with vaccines than pediatricians did at that stage. So we just flooded really that whole 2021 with webinars and seminars, and we invited the best people to come and to talk on the topics and to sort of educate our workforce as well. So that's a really critical thing. So you might not have the specific skills needed, but around you there are, and just ask people who have got the skills to help you. So that's a really critical thing as well. I think with the communication side, again, not everyone, that comes with practice for sure. If you're doing certainly public work, that can be very terrifying, really, actually, and but also it takes. You can learn how to communicate better as well in that regard in terms with the media. But the really important thing is these things that can be very complex, but it's having those skills to bear, and the depth of understanding as well, particularly to address the why. Why is it? Rather than just saying you need to get vaccinated or you need to do this or you need to do that. But the important thing is so that the public or the individual understands why these things are important, and not the skills of not dumbing things down, but putting it in simplified language without using that jargon and technical words and things. So. And I think Asha's brought up this as well. There's always uncertainty. Science is about uncertainty. And, in medicine, clinical medicine, of course, too, you might try something. If that's not what you do, another test, and, it might be something else, so, and you communicate all of that to patients and families. But certainly, again, on COVID, there were these ideas presented as if they were black and white. That it's a definite, you have to do this or you definitely have to do that. But with most things that we did, there was some degree of uncertainty. So our job also is to really explain science, I think, where for those of us who do have a science background, and a PhD, and that's our academic area rather than purely clinical, obviously, but also our job is to explain the science and scientific method and, scientific rigor and quality and about uncertainty, because things do change over time. And so that is actually the reality of things. So, our job is also to have and to explain to policymakers too. Politicians should be more scientific about their approach. Rather than, not. So I think, those some of the things that I think are really, really critical and really came to the forefront, I think, during COVID.
Thank you both. Very nice answers to our questions. And I just want to emphasize as well one thing that Fiona was talking about, the fact that you belong to a group of persons that is trying to go after science, after evidence, makes you feel not so lonely. And so this is why we are trying to build a community throughout the world. And I think that this is something that also the pandemic gave us, this sense that we are all together, and that that we can actually share and live through these experiences and learn from each other and support each other. So I think we're going to be continuing to build a lot of relationships in between societies around the world, especially in the pediatric infectious diseases field. So now we're going to talk a little bit about disparities in healthcare access and vaccine distribution. So Fiona, do you want to start? How can we address these disparities in healthcare access and vaccine distribution, which also has been a very big issue in Latin America as well, and around the world? And how can we engage really underserved communities through a very culturally sensitive approach?
Thanks for that question, Alicia. And I think, again, I suppose I speak more on the perspective of from a policy sort of level and a global, that sort of side of things. So I can talk to that many, but I think, currently we're in a very complex political environment. It's just sort of got worse really this year, and worse than usual. And we're really at a big danger of backsliding even further. We've already backslided from COVID, and countries are in a worse economic situation, and they think, oh, we've spent so much on health during COVID, when we're not doing that anymore. So it's a very difficult, I think, environment at the moment. But what is really critical for governments to absolutely understand is that having a healthy global population is in the best interest of everybody. There's enough resources for everybody really to have a decent life and have access to things, and there should be no country that can't introduce a vaccine because they can't afford it. That's just immoral. And, there was a big outcry for lack of access to COVID vaccines, which we all know was disgraceful. But this has always been the way for pediatric vaccines, and there hasn't been enough voice on that. Thankfully, we've had Gavi, and Gavi's done a great job for almost 25 years now in vaccinating 60% of the world's children for low-income countries, which is fantastic. Which is just wonderful. But most of the children that aren't being vaccinated now and into the future will not be Gavi eligible, or aren't Gavi, or never been Gavi eligible countries. They live in middle-income countries. And it's these children that are living in poor circumstances, because there's a lot of inequity within countries. So we have to take responsibility for this as well. So we've got high-income countries, sort themselves out. We've got low-income countries as a mechanism. But the financial mechanisms and the structures in place for this other group, which is the big middle and not so middle, the poorest lot really, we have to find who's taking responsibility for them to make sure that there's equitable vaccine access. So, 18 months ago, as WSPID, we put out our call to action, for fairer vaccine prices. So vaccine prices is one of many issues regarding vaccine access and uptake, but it's a very critical one with all these different things in the vaccines in the pipeline, and it's taken, some countries still do not have pneumococcal vaccine. 25 years ago, it was licensed in the US. Some countries don't have HPV. Actually, 75% of countries don't have HPV vaccine. 10 years ago, 15 years ago, maybe in Australia it came. Maybe 20 years ago now, even. Rotavirus. Many countries don't have rotavirus vaccines. They're called new vaccines. They're not new vaccines. They're old vaccines. And so why aren't countries introducing these? It's not through lack of interest or lack of, knowledge, by and large. It's because they can't afford it, by and large. The days of dollar vaccines are probably over, so I'm told. And so, but when you stack all these things, and there's all these new vaccines that are going to be coming in the pipeline very soon. It's an acceleration of what's becoming vaccines under development. When you stack those things in what the budget's going to be and the budget impact of the EPI budget, the immunisation budget, it's eye-rolling. We did some work recently in the Pacific. And so, for example, a tiny country in Vanuatu, where they introduced recently pneumococcal, rota, and HPV vaccines. So those three vaccines just recently in the last few years. And the budget impact, they had to increase their immunisation budget by over 700%. So you can see, why the finance minister is just rolling his eyeballs and why there's delays in these vaccines, because something has to give. You have to find 700% extra of money for vaccines, then something has to go away. You either don't do outreach, or you don't do your maternal health program, or you don't provide some other healthcare somewhere else. It's not a finite, infinite box of money to get money out of at a country level. So and this is just going to accelerate and even worsen, because all these vaccines are in the pipeline. So we've got, so for middle-income countries, we have UNICEF. UNICEF do pool procurement. And so I'd thoroughly recommend countries who are middle-income country to procure through UNICEF, because they get, apart from Gavi, can, through pool procurement, get the cheapest prices. But nevertheless, those prices are still unaffordable. For example, the so-called cheapest pneumococcal vaccine for a single dose of the Indian vaccine, it's $7 US per dose. Now that is not a cheap vaccine. When you've got measles, which is, less than $1, for example. So this is huge impact on budgets. So there's these financial challenges that really have not been addressed for the societies and the international organisations that are responsible for access need to discuss this. And so that's why we're at WSPID at the Congress, we're having a whole session on this where we can get we hope all the partners together to have this conversation and facilitate that conversation into how we can move forward and improve access to vaccines.
Very, very important. Yes. Asha, do you have any comments?
Fiona's absolutely nailed it. I would say that the ways to address disparity are continuously thinking creatively. And I would applaud WSPID's action on advocacy. And I think it aligns with our chosen values of collaboration, advocacy, knowledge, equity. So that advocacy and equity piece is, it's not really good enough to have vaccines in a high-income country setting like Australia and not have vaccines available to actually the regional countries around us, where if they're unable to prevent measles, just as an example, measles continuously is imported into a high-income country setting. So there's no benefit to a high-income country setting not being working its hardest to make sure that vaccine equity is available to those in settings nearby. Only if you're focusing on your own national security issues. And to be honest, those are not things that I focus on, but they're sometimes the levers that decision makers focus on. So there are really benefits to everyone for having an effective vaccine program. And I was reflecting on this, a paper that was published a few years ago now, that since it was last year even, since the EPI was introduced in 1974, the expanded program on immunisation, and at the time it was introduced, there was only 6 antigens in the program. Now there's 13. 154 million lives have been saved, most of those in children under 5. I think it's 146 million in children under 5. So it's a massive number of lives saved through effective vaccination programs. And whilst that's the case, I think Fiona's touched on, there are still many, many more millions of children who are zero-dose children or who are unable to access vaccines due to living in poverty in middle-income country settings or in low middle-income country settings where vaccines just have been delayed in uptake, delayed in, I guess, political initiative to get them into place. So some of those vaccines that Fiona described, the rotavirus vaccine, it's not new, and pneumonia and diarrhea are the biggest 2 killers of children still to this day. And so we have some vaccines that are very effective against that, even considering the new RSV immunisation that's now available, or the RSV vaccine for pregnancy, is going to be, and has already been shown in some settings to be a real game changer for infant health. And that is one that the cost has to be driven down, or high-income country settings have to offset in some way having the programs and paying it forward, giving, I guess, the incentive for those programs to be available in low or middle-income country settings. We have to work collaboratively with vaccine developers, with vaccine companies, with policy, with the political frameworks, with all of the organisations like Gavi and UNICEF that Fiona has described, to be able to create the space for vaccines to flourish and for them to be available in an equitable way to all children across the globe. And I think that has to be a real mission for WSPID, because as pediatric infectious diseases people, we may be great at treating the end stage of pediatric infectious diseases, but we should be even better at preventing them. And vaccines is the way for child health to continue to improve, is through preventing these diseases through vaccines. So lots and lots of things that need to happen.
Can I also add to the thing, one of the key solutions, I think, also to making it equitable is the role of developing country manufacturers. And again, through the COVID, that's really become a key area. And so I think that's fantastic progress. So, for example, Gavi procure some of their and increasingly have a wider market from which to procure from for their own vaccines. So, as I mentioned before, the pneumococcal vaccine, there's the cheapest one is from India. It's pre-qualified with WHO, Pneumosil, so perfectly fine for the vast majority, for countries to use for the bulk of invasive pneumococcal disease. So that's and available through UNICEF. Last year, there was the newer bivalent HPV vaccine that was available through a Chinese manufacturer. Again, it costs, compared to the other vaccines, it's about $2.90. It's probably 20% the cost of the other vaccines that are currently available, but again, pre-qualified through WHO. So there's also rotavirus vaccines that are made through India as well that are all pre-qualified as well that are available. So I'd really thoroughly encourage countries who are pediatricians also, because they might be on the NITAGs and the decision making within countries to be aware of the repertoire of what's available as well, to make sure that you're paying the best price. The best price will be available through UNICEF. UNICEF prices are all publicly available. And so you shouldn't be paying more than UNICEF prices if you're a low or middle income country and you're procuring on your own. And that's all published through WHO as well. So being aware of what you should be paying so you're not paying too much. Because if you're paying too much, it means you've got less money for the rest of your program as well. So just, being aware of those new products that come about and having confidence if they've been pre-qualified through WHO, then, it's important that having confidence in those products as well through developing country manufacturers. So that's a very exciting space, and that really needs to be emphasised and promoted sort of a lot more, and a lot more awareness regarding that is really important, because I think that's one of the key solutions to this issue. Yeah.
Thank you, Fiona. Now let's talk a little bit about routine vaccinations, which, in my country, Guatemala, and in general in Latin America, we have been lagging, behind with all of our routine immunizations. And I think that even some of our colleagues it is hard for them to, talk about having a complete vaccination schedule for kids with parents. So, why is this important, and why is it important to have routine immunizations completed, and how can this allow us to prevent outbreaks? Can you comment on this, Fiona?
Alicia, sorry, just to clarify your question, are you referring to children dropping out, not coming back to complete, or do you mean, is that?
Yes. Yes, it's like kids maybe having some of their vaccines, but they are not completing their schedules. And I don't know if it's because they have lost trust in in the vaccines, or maybe we have not emphasized the fact that it is actually important to get all of your boosters in order to get the best immunizations and protection available for those preventable diseases. No.
Yeah. Okay. Yes. No. Thank you for clarifying. Yeah. So that's that certainly is an issue. It's always been an issue, and probably increasingly so as more vaccines also potentially are delivered beyond the infant period as well. So we've generally been reasonably good in the first year of life, but then after that, there's considerable dropout. From 12 months onwards, and particularly in adolescence, and then you've got adults. But our focus is pediatric. But yeah. So that's a really, and I think increasing sort of issue, how to improve that coverage, which is so important. So I think if again, from a program level, I'm thinking, if you don't know, then it's really important to do the research to find out. So some of it may be that they've exactly the things that you've said. There might be some sort of misinformation, or they don't think it's important, or whatever. Or a lot of the reason that certainly we find in our own context is lack of access, unaffordability, cost of living. They don't have the money to get the taxi or the bus or whatever to come back to the clinic, and it's actually access issues rather than they don't really want the vaccine, or they think, oh well, they've had 3 and or 2 or whatever, and the last one's not so important or whatever. So it's really the most important thing is having a bit of an evidence base, I think, to try and find out why. And then from a program point of view, then having, an informed program or, strategy then to help address whatever the issue is. But I think a lot of, in our context, is access, actually, and people just don't have the time. I know with my own kids, it's very hard to get them the flu vaccine every year because it's, I wish they just did it at school. It would be so much easier, if they just did it at school. But now we've got a pharmacy program at least. But, you can go to the pharmacist. You don't need a booking and just rock up and get a jab. So that's great. So improving access, I think, is a key thing. But again, it's very context specific.
I think, Alicia, as well, it's the responsibility and the opportunity for pediatricians is building great child health systems. And so we really, for a vaccine to be effective and for it to reach every child, it's actually about the logistics and the system that's being built, and then doing the research, as Fiona described, to break down the barriers to access. So we do have to have an interest and a focus on how do you build those systems that can operate across the landscape of your local context to ensure that every child gets a great start in life. And building those systems, I think, are really important as well in thinking about parents as they become new parents. None of us have ever done it before. Like, I certainly remember, my firstborn, and not really, like, even as a pediatrician, not really actually knowing what to do. And so our job as child health workers across that system is to encourage good practices. And so having conversations at every child health encounter about immunizations, about their safety, about the reminders, about why the timing is structured as it is, and continuously taking every opportunity in child health to remind families about the importance of vaccines. Because, as Fiona said, it's super easy to get busy, to forget, to not realize it's a priority, or to have barriers in the way, including financial barriers to access services that might become difficult. And I think in Australia, definitely the role of pharmacists in being vaccinated has been a big breakthrough in trying to increase our flu and COVID vaccine uptake. Unfortunately, in my state anyway, they're not approved to vaccinate under 5s. And so we do have to have a different model for that age group. And I think there's good reason for that. I think the safety and the child health encounters are important to maintain for that age group. But for each local context, to think about it, a very structural and systematic way of ensuring access to vaccines. And, my mind's been expanded. My husband actually works in running the logistics component of the vaccine implementation for the state. And it's all about the temperature control, the refrigeration. In COVID, it was obviously with some of the vaccines being at -80 freezer temperature, like figuring out ways to ensure that you maintain that cold chain all the way through to vaccine implementation is also something that pediatricians can pay attention to, can be involved in research in, can help oversight, and can really make sure that if a child comes to a clinic or to a child health encounter, they have the opportunity to be vaccinated because the vaccine's in the fridge, because it's available there. And I think that's a really important thing. Something that I was just considering as we were talking is the way that smallpox was eradicated in the world was all about the logistics and the systems, and really focusing on how to deliver the vaccine to as many people as quickly as possible through really robust systems. And so having systems research is also really, really important to continuously improve that. And we know that strengthening healthcare is probably one of the hardest things to do when there's resource challenges, and yet it has to remain a priority. And we saw in COVID that the breakdown in the healthcare systems, because of many, many changes happening so quickly, did have an impact on the childhood vaccine uptake. And so once again, it's another area for us to pay attention to, maybe not to be doing all the work in, but at least to be aware of as it being an important component of how to make sure that everyone has access to vaccines.
Wonderful. And then, so we have this last question. We are about to finish, Do you think it's important that pediatricians work together with policymakers, maybe schools, uh, churches, community in general, to strengthen trust? And if you have any successful examples of any collaboration in between pediatricians and any member of the community that has actually been successful, we would love to hear it. So
Well, I'm happy to jump in. I absolutely think pediatricians have a role in every single space. An example that I'll bring to our attention is it's maybe a unique Australian example, but it might also apply at many places in the world. When we were trying to implement a COVID vaccine program in Australia, one of the significant components of difficulty was that many different migrant communities and language groups weren't receiving the same messages as those who spoke English, because English was the dominant language and that's what was being communicated. And so really making opportunities for all of our healthcare workers who actually speak a second, third, or fourth language to connect with those communities and tell their personal experience, talk about the strength of the science around the vaccines, and really making sure that there was the first language of people was the language that they were hearing the story in, rather than their third or fourth language. And so mobilizing your workforce in different ways to make sure that stories were told. And I had colleagues who spoke many different languages from the Indian subcontinent and were able to reach that particular population with a communication. Even just being a familiar face in the community was a really important component. I don't know, Fiona, you've probably got different stories, but love to hear them.
Yes, no, I think it's a great question, and I think absolutely yes. And I do a lot of advisory things now, which I really enjoy, and the reason why I do them, and whether I do when I decide to do it or not, is really what can I bring as a pediatrician to the table. To advocate for children and things, and can I make a difference, or have the pediatric voice, the child's voice in, and I'll give you a couple of examples. So currently I was on the WHO, came out of COVID, again, the strengthening of clinical trials. So, during COVID, there was 95% of the trials that were done basically were a waste of time, and because of the quality of what was done. And so WHO, through the World Health Assembly, now had a mandate to improve clinical trials. So as we all know, children were last in the clinical trials and pregnant women didn't even get a look in. Right. So when I go to those meetings, and that was all part of it too, was to make sure communities who were underserved and populations actually were visible in these guidelines and in, all their audit materials, and assisting countries to have the capability and capacity to actually do trials in underserved populations as well, not just healthy men, or which was some of the trials were just done in healthy men, and also in Caucasian populations. So that's one example of the importance of pediatrician and the policy. And again, another example was that the decisions, as Asha sort of brought up before, about school closures and things, it was really absent of the science of child development. In the neuroscience of child development, we all know as parents, we all do this as parents, we all know, how important child development is. And that's why we organise play dates and sleepovers and singing and sport and all the rest of it, because we all want children to be their best, right? And so meaning reaching their full developmental potential, which is the wiring of their brain. But when COVID came, we all just sort of thought, put them all away for 2 years, more or less, and we'll bring them out 2 years later because they're all right. Everybody else has got problems, so we'll just bring them out, 2 years later, more or less, and deal with them later on. But we completely neglected the science of child development. And there weren't the people at the table. There weren't the people at the table. There was a huge silence on that, advocating for that. We've just in Australia had our whole COVID inquiry, and children appear fabulously in that, thank goodness, the needs of children, whatever. And now we've got H5N1, and probably the next pandemic will be an influenza type 1, and children will be more affected. Again, are there plans in place? Are the policies and the strategies, have they got anything about schools? No, they haven't. There's nothing in there. They all mention it, what a problem it has been. But when you actually look at the strategy, they're missing They're still missing. 30% of the population is still missing. So no one even mentions it. Even in our own professional society, we've got our own professional society conference coming up next month talking about all of this. There's nothing in there about children still. So, you just have to, children are constantly forgotten about. They're constantly at the bottom, by and large, particularly in this context of where you have to kind of not compete, I would say, but you're at the table with people who do adult stuff. So you're just constantly having to be the voice for children. And that's our role, is to be the advocate and to constantly make sure that whatever decision's being made, how is that going to affect children? And I think with our training implicitly, we are generalists by and large. We think about the child in its family, in the public health context, how they're functioning in the school and immunisation and all of that, which is very different from adult medicine. So we're trained a bit more holistically about the child rather than the kidney or the heart or whatever. So, it comes to us through our training. So I think we've got an incredibly important role, to speak up and to speak and to make sure that we're advocating for the needs of children.
Well, thank you both. And I think we've had great talk and conversation about advocacy and trust, and I'm sure I have learned a lot. And our public, our audience, is going to learn a lot from both of you. So I thank you very much for your time. And before we leave, I just want to make a last call just to make sure I haven't forgotten anything important in terms of questions or comments, or maybe you want to give us a few takeaway messages. So the microphone is for both of you.
I was just going to add, thanks, Alicia, and great to hear all of these different stories discussed. More of this will be at the WSPID Congress in Bangkok in October 2025. So Fiona and I will both be there. I hope, Alicia, you'll be there too. But we really want to see you there. We want to be able to have more of these conversations, and we really want you to come and tap us on the shoulder and just say hi. And I'd like to talk more about this. I'd like to learn from you. I'd like to, challenge you on something that you said. Please join us at the WSPID Congress in Bangkok in, I think it's 28th to the 31st of October 2025.
That's right.
Yes, I fully agree. Look, I'm really looking forward to meeting people in person at WSPID Congress at the end of October. So, and to continue this conversation, as Asha said. So it's absolutely fabulous. And thank you so much, Alicia, for having us. I've really enjoyed having a chat. And hopefully we'll see you and more people in person in Bangkok.
And that's the end of today's episode. Thank you to our guests, Professor Fiona Russell and Professor Asha Bowen. To find further resources and educational content, you can visit the Global e-learning portal on the WSPID website, your hub for pediatric infectious diseases insight. Whether you are on your way to or from work or doing the school pickup, thank you for listening to the WSPID podcast. Make sure you are subscribed on your favorite podcast platform so you don't miss an episode. Please share the podcast with your colleagues, leave us a review, and be sure to tune in next time.